here we are in the middle of August, in the middle of a terribly infectious period of this virus, putting people's lives at risk. And yet we don't have contact tracers. We don't seem to have a plan. And where is this federal money going?
Hawaii U.S. Congresswoman Tulsi Gabbard today, the latest to launch a verbal attack against the State Department of Health, specifically targeting contact tracing. The question, will this go from criticism to a federal investigation?
She didn't answer that question directly, but Gabbard is demanding accountability and oversight. KITV4's Diane joins us live tonight. And Diane, Gabbard did not pull any punches.
That's right. Simply put, though, Gabbard says she is angry and she wants Governor Ige to institute some kind of change of leadership here at the State Department of Health. And she didn't use the word investigation, but she does confirm she is pushing for some kind of federal action.
Most of the pressure being felt at the Department of Health has to do with contact tracing.
The word shocking doesn't even begin to describe how appalling it is to see that as our state has the highest rate of COVID infections in the country, we essentially don't have an effective contact tracing team or strategy in place.
More people have been sick.
Lieutenant Governor Josh Green confirms there's whistleblowers making accusations that there's less than 24 contact tracers working in disorganized conditions. Director Bruce Anderson says there's more than 100 of them on the job.
We have a handful of people working really, really hard to try to do an impossible task where their caseload is so heavy that they're not able to actually reach out to those individuals in a timely fashion within 24 hours in order to make sure contact tracing is even effective.
The fact that the Department of Health is utilizing donated space in a credit union conference room downtown is indicative of the fact that they need help and they need urgency.
Gabbard wants to know how Hawaii is using the $50 million in federal CARES Act money it received for contact tracing.
The Department of Health has tens of millions of dollars for this purpose. They have talked and warned us since early in this pandemic about the need to be prepared for a so-called second wave of the virus. And yet we don't have contact tracers. We don't seem to have a plan. And where is this federal money going?
Will you be calling for a federal investigation or anything like that?
Oversight and accountability is absolutely necessary. We're exploring different options to bring about that oversight and accountability.
Last week, Senator Jarrett Keohakalole, part of the Senate COVID-19 committee that made a surprise inspection at the Health Department's contact tracing division. He's not interested in a federal inquiry.
I don't think it's the answer. I don't think we have time for that. We're in the middle of a crisis. We need action.
Neither does he want this.
Dr. Sarah Park and Dr. Bruce Anderson should no longer be leading our Department of Health. I hold Governor Ige responsible to make this decision.
KITV4 asked the Department of Health for an update on hiring contact tracers and for a response to Gabbard's criticism. We did not receive a response. Governor Ige released this statement Tuesday, quote, "The Department of Health has played a critically important role in this unprecedented battle against a global pandemic. I am in ongoing discussions with DOH leadership on ways to improve our testing and contact tracing systems and capacity, and we are confident plans and resources are being put in place to meet the needs of our community," end quote.
All of the excuses that have been given so far, Diane, whether it is lack of space, lack of funding, lack of support, it's all shibai.
Gabbard says she hopes to release any more details regarding this federal action that she hopes to create by the end of this week. And new at 10 o'clock tonight, we will tell you what the Senate COVID committee investigating this issue is asking from the Department of Health regarding contact tracers. Live at the Department of Health, Diane, KITV4 Island News.